So now we're going to have Sharon Thompson speak to you from Tri-Valley Inc., and she is part of the state home care program. So, Sharon?
Oh.
Were you trying to get a photo?
Go ahead.
Thank you. Good afternoon, everyone. My name is Sharon, and thank you to the Uxbridge Police Department and Uxbridge Senior Center for having me come to speak on behalf of Tri-Valley. Is there anybody in this room that is familiar with our agency? Have you heard of Tri-Valley? Okay, good. I know I spoke with a few of you earlier, so I'll give you a brief overview of what our department does. So Tri-Valley has been around since 1976. We are located in Dudley, Massachusetts, but we do cover the Uxbridge area. Our territory goes as far west as Warren and as far east as Franklin, and we cover everything in between. So our mission statement is to promote and maintain an optimal level of independence, dignity, and well-being for elders and individuals with disabilities by providing information, advocacy, and access to quality services and resources, as well as caregiver support. So state home care, what in our particular department is to provide services to people age 60 and over to stay at home safely and independently as an alternative to nursing home placement. So if anyone needs assistance in their desires to stay at home, we come out to do an assessment to determine their eligibility, which is based upon being 60 years or older or under the age of 60 with a formal diagnosis of Alzheimer's or a dementia-related disease. You also have to be a resident of Massachusetts, and we have to be meeting a critical unmet need, which could be bathing, grocery shopping, med management, dressing, eating, which is something that the case manager would go over with you when they come out to do an assessment. So for us to come out and do an assessment to see if you're eligible, or anybody that you may want to refer is eligible, there is no cost for that visit. There is a copay for services once we open you, which is based upon your income. But for us to come out just to meet you and to go over what we're all about, there is no charge for that first visit.
Yeah, right.
So some of the services that we offer that you may be familiar with are homemaking to assist with your cleaning, your vacuuming, your grocery shopping. We provide laundry service, personal care and home health aid, which is determined by our nursing department to see what would be better for you, what kind of equipment you have in your home. Transportation to and from any kind of treatments or medical appointments. Chore services, Meals on Wheels, companion services, nursing, physical therapy. We work very closely with the visiting nurses. So when they have somebody that they're providing care for, we often receive referrals from them and we work closely with them. Adult day health, if there's a caregiver that requires respite, we provide adult day health services for their loved one. Medication dispensing system, if someone needs assistance with that. Personal emergency response system, which you may recognize more of a lifeline, the button around that you wear a necklace around your neck or a bracelet. Respite for caregivers, Alzheimer's, dementia, and coaching if anyone requires assistance, and supportive home health aid. Does anybody have any questions on the services that we provide? I am going to be staying after, so if you do think of any questions, please feel free to come and speak with me. So delivery of services. So if I come out to see you and I do an assessment and I ask you or someone that you know a bunch of questions, what's your medical background? What can you and can you not do around the house so I can figure out what kind of services you may be eligible for? We come up with a care plan together. So then let's say, for example, we come up with, okay, let's put in 3 hours a week here to help you with your homemaking, your laundry, and your shopping. You agree. Now you have a choice. Do you want to get that service from a contracted provider? So we contract out with 19 providers. You may have heard of Catholic Charities, Medical Resources, or some of the names you may recognize. They provide the people who come into the home and do those services for you. So that person's coming in every week. So you have a choice to go through one of our providers, which we assist with, or you can take that 3 hours and you can get that through what we call consumer-directed care. I don't want to go through your provider network. I want my neighbor who's been helping me to fill those 3 hours for me. We can help you with that. You have that choice to do that. There's a lot of startup paperwork because in a sense you're becoming what's called the employer. You have to fill out tax paperwork, all of that, but it's only startup. And then now you're in charge. You can hire whom you choose to provide those services for you and set up the schedule how you want. Okay? So those are your two choices for the delivery of services. Some of you may have heard of what's called the Frail Elder Waiver, otherwise known as FEW. This is for people who need a higher level of care of services but need to be on Medicaid to get those services. So right now, for the Medicaid income amounts, if you are an individual and you're making $1,041, or a couple that's making $1,410 a month, you can get onto Medicaid. But you may be someone who's making a higher amount at about $2,313. So with the Frail Elder Waiver, you can have a higher income to get onto Medicaid, but the second piece is you have to be clinically eligible, which our nurses determine for you. So if you have those two pieces hand in hand, you get onto Medicaid, you're clinically eligible for the services, we can get you onto Medicaid and then into a program that provides more services for you. Care management. So you or someone you know becomes a client of Tri-Valley's, you're getting the services. We've talked about the delivery of services. You can go through a provider, or you can become your own employer and do it through consumer-directed care. You will have a case manager assigned to you who will come out to visit you throughout the year to assess the services that you're getting to make sure that they're still meeting your needs, or has there been a change? Do you need more services? Do you need more help, or do you need less services? We come out to visit with you to make sure, and all the services take place in your home. We also meet with your family members. They can also be part of that visit as well. So we also communicate with any providers that are in the home. So if somebody has people coming in once or twice a week, they notice that maybe somebody's not feeling too good, they may need some more help, but we're not due to go out for another 2 months, they call us and tell us something's going on, this person needs some more assistance, and then we make a home visit to go out to see what's going on. We help with public benefits, mass health applications, fuel assistance, food stamps, housing applications. We assist with that. Your care manager will link you up with those services. So how do you refer over to Tri-Valley? So anybody can call our agency. You can call for yourself, you can call for a loved one, you can call for a neighbor, you can call and be anonymous if you choose to, but you can call the numbers that are up here and you can ask to speak with our INR department, and they will walk you through the process. They'll ask you what is the name of the person you're referring, phone number, address, and then what we do is we assign that to a care manager who will come out and do a home visit and assess for your eligibility of state home care. So this is for people who are choosing to stay at home safely. They want to stay at home and get their services there, but you need a little bit more help. Years ago, people thought that the only way you could become a consumer is if you were considered homebound. That is not the case. If you are, I can give you a really quick example. We had a woman who we went out to assess, I don't want the services. And we started asking her questions about what she can and can't do around the house. She was telling us that she was doing her grocery shopping every week, which is great. That's wonderful. We encourage people, get out of the house. Go out to the store on your own. Take the bus if you can. She was able to go to the grocery store, but when she was coming home, she had 7 stairs she had to go up. So she would come out with 7 bags, and then that was 1 bag per trip up and down the stairs. So 7 trips up and down the stairs to bring the groceries in. What we explained to her was, we can come help you. We can come out once a week. We can do the big heavy shopping for you so you don't have to worry about all those trips, but you still go out on that trip. I think it was like a Wednesday that the town had set up for the bus to come for people to go to the local Walmart. And we encouraged her, keep doing that, but you don't have to be doing the bulk of your grocery shopping. You can come home with that one bag that you're just going, making one trip up the stairs. We'll do the heavy part for you. That kind of turned it around for her to be a little bit more receptive to services. So it's to support your decision to stay at home and receive the care that you may need or someone you know may need. Does anybody have any questions? Okay. I have pamphlets up here that have all the phone numbers here. I have pens. I have goodies up here. I have clips and everything. So if you're interested, come on up and I'll walk through the tables as well. Okay? Thank you.